So you're thinking about having a facelift, or you're just exploring what a facelift involves. I'm going to be talking about the truth of the facelift, what it actually does and what it doesn't, and what you should be expecting from your surgery. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. So what is a facelift and what is it supposed to do and what shouldn't it do? First of all, we'll break down the various techniques, we'll simplify things for you, and then hopefully this will give you a better idea of what to expect if you are exploring the idea. So what exactly is a facelift? A facelift is a very generic term. What it means that we are lifting the face to produce a more rejuvenated, youthful look. As you age, you lose the triangulation of the face, you develop a more rectangular lower part of the face, and you lose the volume in that mid part of the face. And what a facelift does is lift the face to bring back the triangulation of the lower part of the face and redistribute the volume and the skin from the lower to the upper. Now, there are a variety of ways of doing this. Number one, as a plastic and reconstructive surgeon, surgically is an option. And what this does is that we separate the skin and muscle layers and lift the face by repositioning those muscle and skin layers in a higher position and removing the excess skin. Now, depending on what is right for you will determine where we will do that lift. So we look at the faces in thirds, upper, middle, and lower third, and each surgeon will have their own technique depending on their own experience, what works for them. Generally, it will involve a degree separation of muscles, which varies depending on the different types of facelift, and then this will be repositioned. So there may be descriptions of ponytail lifts or deep plane facelifts or SMAS lifts. They are all variations of separating the skin and muscle, and the vector of pull or the direction of pull will vary depending on surgeon's experience and what you need. So are there any other forms of facelifts or people that describe facelifts? Strictly speaking, yes and no. So the other common forms of facelift are non-surgical, but you may have heard of, are when people use fillers and Botox to perform a facelift. So how do fillers create a facelift? So the primary goal of a filler is to fill the face. It's very simple. When you add filler to a face, the indirect or secondary effect is to lift the skin at the same time. So if you have filler along the jawline here, although it's filling the area, it is filling the skin, and as it fills the skin, it lifts the skin. So that way people describe using fillers as a form of facelift. It's not the primary goal, but it's an indirect secondary goal. And I have to say, it's a less controlled method. Also, it's not permanent. The other way that people describe a facelift is when they use Botox. Now, how does Botox lift the face? When you use Botox, the primary goal is to paralyze different muscles. And when you are performing a facelift with Botox, you are selectively paralyzing certain muscles to allow the lifting muscles of the face to be more apparent or more obvious. So one example would be in the eyebrow. If you wanted to lift the outer eyebrow, what you would do is paralyze the inner eyebrow muscles, which are along here, including the corrugators and the procerus muscles, but not paralyze these muscles. So these will lift as these remain paralyzed, and that will give the angled lifted approach. The other approach, or the other aspect of the facelift and Botox, is in the jawline. Now, we have multiple muscles in the face. Generally speaking, or simply speaking, you've got the muscles that lift the face, and then you've got the muscles that lower the jawline. And primarily the muscle that will lower this jawline or create a pull of this jawline is your platysma muscle just along here. So if you paralyze the muscles that pull the jawline down, but leave these muscles active, what would happen is that you would have unopposed action of the muscles that lift the face, and this would give a temporary, good, subtle facelift effect. But what it's not going to do is reposition the muscles. It's not going to dramatically change the shape of the face, and it's not going to remove excess skin, which is what a lot of people require when it comes to a facelift. So now we know a facelift is generally lifting the face. What does it not do? So as you age, we've already described you have a change in the shape of your face, which is due to the laxity of your skin and muscle. But there are other important contributing factors which we do need to address or discuss. And these are the loss of volume of the face. So yes, we have a drop in the face, but we also have a loss of volume. And this volume is due to loss of subcutaneous volume, which is the layer just underneath the skin that covers the entire face. And also the pockets of fat that exist in the face become dropped and also reduce in volume. There are also skeletal changes, but we're just going to focus on the aspects of the soft tissue. The other aspect to the aging face is the quality of skin. Now, when you are young, when the muscles are active, the skin overlying the muscles are able to stretch and relax easily without forming any lines. But as you age, the muscle will continue to work, and the overlying skin loses that ability to bounce back and starts to leave permanent lines due to the reduction in the elastin and collagen, which are described as static or dynamic lines, which appear only on movement. So when it comes to the facelift, knowing what the aging face is, what does it do and what does it not do? So a facelift will lift the face, as we've already described. What it will not do is add volume to the face. It's not going to add volume to the subcutaneous layer, and it's not going to add anything to the hollowing of the cheeks. In fact, in some cases, if you stretch the skin out, it can exacerbate the hollowing of the cheeks if the facelift isn't done appropriately. So that's something that you need to be aware of. So when you do have a facelift, some surgeons, including myself, if there is volume loss, they would do a fat grafting procedure, which will add the volume to areas of the face to help reshape the face. So a facelift per se will not add volume to the face. It will lift the face, and to add volume to the face, we need to do another procedure during that facelift or prior to the facelift, and that is fat grafting. A facelift will not remove the deep lines of the face. It might improve it, but it will not remove the deep lines of the face. And this is particularly true in the nasolabial fold and occasionally the marionette lines. What it will do is might stretch it out, it might stretch the overlying skin out and improve it. It will not eliminate it. So again, extra work needs to be done, focused on these areas to eliminate or improve those lines further. And this again uses techniques such as fat grafting to lift the deep aspect of the wrinkle or the deep lines up, and maybe some chemical or surgical resurfacing to flatten the top layer of the skin. So these are added procedures that you need to consider if you want to address these issues. The facelift will not rejuvenate the skin. It will not remove blemishes. It will not clear your skin as such. So if you wanted to address these issues, the best way to do these things are pre-preparation before the facelift. So ensure that you are using the appropriate serums, lifestyle changes, and maintaining that skin rejuvenation process after the facelift indefinitely. And that includes using LED face masks as well. So again, a facelift will lift the face, but it will not rejuvenate the skin. But the other aspect of the face a facelift will not address is anything in the middle aspect of the face. So if you have excess skin in the upper eyelid, if you have fine lines in the upper lip, if you have fine lines in the chin, none of these will be affected or improved by a facelift surgery. A facelift surgery, as I've already described, will lift the face. The lift stops just outside the lip, so it doesn't affect the middle aspect of the face. If you wanted to address the upper or lower eyelids directly, you would need to have upper eyelid blepharoplasty or lower eyelid skin pinch or lower eyelid blepharoplasty. Around the mouth, again, it can be very difficult to treat these areas, and this will need to be combination treatment using fat grafting, chemical peel, surgical resurfacing, and that will likely to be a stepwise approach to addressing these issues. So we know what a facelift does. We know it doesn't improve the quality of the skin. We know it doesn't add volume to the skin. We know it doesn't improve the lines or the issues in the inner aspect of the face. And we know it doesn't remove deep lines. So to address these issues, you need to have additive procedures such as a fat graft, additional surgical procedures such as an upper eye blepharoplasty or fat grafting in the upper and lower lips, as well as other additional procedures. The other myth about facelifts is that once you've had it done, you'll be sorted without having to do anything for the next 10 to 15 years and you will look great. Unfortunately, that is not the case. A facelift should last, but is also dependent on you being able to maintain the quality of the skin, the volume of the skin, lifestyle changes, and that way these facelifts will hold up. Now, in social media, people and they've had a facelift and you think they look great, and they do look great, but they haven't just had a facelift. They've had weeks or months of pre-facelift preparation. They've had additional surgical procedures such as fat grafting, either before the surgery, and continue to have additional small procedures afterwards to maintain that lift. And that's really important to understand, as well as the fact that they've had great filters and great makeup artists and likely a huge team to ensure that they have a good image displayed. So when it comes to an individual person coming and wanting to achieve this look with one surgical procedure and nothing else, it's an unrealistic expectation, I'm sorry to say. So the other things is it important to know after a facelift. When the face ages, you lose the subcutaneous fat. One thing that slightly frustrates me about facelift procedures and the photographs and the befores and afters that you've seen on Instagram or YouTube is that you will see the before picture, you'll see the immediately after picture, and you'll see a few weeks down the line. This is not really the appropriate time to judge a facelift. To really judge a facelift is to look at the face at least 1 or 2 years after the surgery when all the swelling has gone. Because one of the reasons, as we've already described, for the aging face is they lose the subcutaneous fat. And after the surgery, what happens is you get a significant amount of swelling. And that swelling occurs in all of the subcutaneous layers of the face. So when you have a facelift, you still have swelling in the subcutaneous layers of the face, which gives the illusion of a rejuvenated look. And patients look great. They look great during this period, but they look great because, yes, they've had a facelift, but the additional swelling, which isn't a permanent effect of the facelift, it's a side effect or a byproduct of the facelift. And then after a few months' time, it will drop, and then the true results of the facelift will become apparent. So that's something to keep in mind when you look at befores and afters of facelifts. Find out the timing of the after, and it's best to look at facelifts maybe a year or 2 after the surgery to give you a true idea of the results of a facelift. So that's a lot of information. I hope it's been of interest to you. If you have any further questions, do let us know, and hopefully we'll see you in the next video.